Hi, this is Dr. Dean Kaleda with the Calaveras County Public Health Department with some information today about seasonal influenza and some information about the influenza vaccine. As most of us know, influenza is a respiratory infection, and it causes us to be sick in a lot of the ways that most of us have been sick before. It's transmitted from person to person, it's caused by a virus, and it causes symptoms such as cough, congestion, headache, fever, muscle aches. Most of us have experienced influenza infection at some point in the past. The important thing I want to impress upon you today is that influenza can be serious in some people. Some people can be at high risk of complications from influenza, and it's important for those people to protect themselves with the influenza vaccine. Flu can be passed from person to person, like I said, and the most important way to protect yourself from getting sick from influenza is to receive an influenza vaccine. If you remember last season, we had the H1N1 virus circulating as well last season. H1N1 was also referred to as swine flu. So last season was a little bit more complicated. There were two types of flu shots. There was a seasonal flu shot and there was an H1N1 shot. Now this season it's simpler. There's one flu shot. It's the seasonal flu shot. It contains 3 strains of influenza virus that it protects people against, and H1N1 is one of those 3 strains that's in this season's flu vaccine. And it's the same H1N1 strain that was in the 2009 vaccine from last year. Now, who should get a flu shot? This season it's recommended that practically everybody get a flu shot. People who are over 6 months of age all the way up to 106 should get a flu vaccine to protect themselves this season. So who should get a flu shot? You. Pretty much everybody over 6 months of age are recommended to get the flu shot. Now there are some people who are at higher risk of complications from influenza were they to get it, and so those people in those groups are much more important to get the flu vaccine. So those are people who are younger. Children under 5 years of age can be more at risk of complications of the flu if they were to get it. Pregnant women can be more at risk of complications. Adults over the age of 50, I used to call those groups elderly, but not so much anymore. So people over the age of 50 are recommended to get a flu shot. And anyone who has a chronic disease, such as lung disease, heart disease, diabetes, anyone who's received an organ transplant or takes medicine to reduce their immune system should get a flu shot because they're in high-risk groups. If you have a contact to anyone who's in those more high-risk groups, again, doubly important for you to protect yourself by getting a flu shot this season. The flu vaccine is safe. The flu vaccine has had a long track record of safety and effectiveness. This season's flu vaccine is made in the same way that the flu vaccine's been being made for many years now. And it has an excellent track record of working and being safe. Most people will only need 1 dose of vaccine. Children under 8 may need 2 if it's the first time they've ever been exposed to the vaccine before, but most people will only need 1 dose of vaccine this season. It's important to protect yourself from the flu, and it's important to protect your community by getting a routine flu shot, because if everyone in the community is vaccinated against the flu, it reduces the risk of transmission to other people who might be more vulnerable or who are at higher risk of complications. So get your flu vaccine now. The County Public Health Department has flu clinics, and you can see the schedule of our flu clinics at our website, www.calaveraspublichealth.com. And if you need more information about the flu vaccine or any other public health questions, call the Health Department at 754-6460. Thank you.